Good afternoon, friends. I would like to welcome you all for this national webinar on psychosocial wellness of healthcare workers during COVID-19 response and launch of ShareCare app, which we have developed with the support of UNICEF. So for this, we have a speaker from our institute, Professor Pratima Murthy, so who is our director, who has assumed to a director position yesterday. And I would welcome you, ma'am, for this national webinar. And I also would like to introduce you later once you begin your session. So I have made some notes about you, which I want to talk with, present it. I also like to welcome all my professional colleagues who are representing from various departments, like Department of Clinical Psychology, Department of Psychiatric Social Work, Department of Psychiatry, and other departments from the Institute. And I also like to welcome all my co-partners who have helped me in terms of developing this app. To name them from my own department, it is Dr. Arati Jagannathan, then Dr. Kanmani, who have supported me in developing this app. And then we have Dr. Seema Mahorotra and Dr. Ajay from Department of Clinical Psychology, who again supported in terms of developing videos and gives a lot of ideas in terms of how to make this user-friendly. And then I would like to welcome Dr. Prabhat Kumar Chand and Dr. Geeta Desai from the Department of Psychiatry, who again helped in terms of conceptualizing this whole project and how to plan the app. It was Dr. Prabhat who gave me the first idea, and then I went and discussed with Dr. Pratima Murthy in the beginning, and she made me to look at the importance in terms of expanding my team and involve many other players into the team so that the app can be more user-friendly. And then I got support from Dr. John Vijay Sagar and Dr. Rajendra from Child and Adolescent Psychiatry Department, who also supported in terms of developing material for question and answer for app development. And then we had Dr. Shivram Varamballi and Dr. Hemant, who supported us in developing yoga-based interventions, which can go as part of the app. So all without this support from all my team members, I was not able to complete this. So I welcome all of them who would present here for this national webinar. And also we got an enormous support from Sindhu, our computer engineer, who made us finding out the vendor and rolling it out with all the technological support. So I also welcome Sindhu madam for this. And then we have eminent speakers today. So first I would like to welcome Mr. Luigi D. Aquino, the Chief Health of UNICEF India, who is going to give his remarks immediately after my presentation. And then we have Dr. Gautam Saha, President of Indian Psychiatric Society. Then we have Dr. Anant representing from National Health System Research Council. And then we have Dr. Bal Inamdar, Chair of Rotary India Health from Curative and Past Rotary District Governor. And then we have Dr. Atrai Ganguly, National Professional Officer, Mental Health and Substance Use from WHO. Then we have other people who supported me in developing this app in terms of my project staff, Dr. Sudeep Joseph, and then Charmi and Karishma Khan, who right now are taken up other jobs, but they initially supported me in terms of developing this app. So I also like to welcome them for this national webinar. And I would also like to welcome all the participants who are representing various fields in and around the country who have taken interest in terms of participating in this national webinar. So I welcome them all. And I also like to welcome my UNICEF partners, particularly Vivek Virender Singh, then Priyanka Singh, who played a major role in terms of getting all these people into the board. And because of their support, we were able to organize this national webinar. So I welcome you all, sir. So what we are going to do today is we are going to have 30 minutes. We are going to request our director, Dr. Pratima Murthy, who is going to talk about mental health issues in healthcare workers during COVID-19. Followed by that, we'll have a panel discussion. So where 5 eminent speakers are going to share about their views. And then it's open for question and answers. And then we are going to talk about how the ShareCare app can be downloadable. And then we are wanted to launch out the ShareCare app. So this is the process what we are going to follow for next 2 hours. So once again, I welcome you all for this national webinar. Now I would request Mr. Luigi Di Aquino to give his remarks.
Good afternoon, and good afternoon to everybody. First of all, let me wish everyone a good Saturday afternoon. I hope I'm audible. And it's lovely to see more than 120 participants with us today. It really speaks to the importance and relevance of what we are trying to do all together. Before I share my 2 cents, I really wanted to express my warmest and best wishes to Professor Murthy on his new assignment. I think we were together, must be about a year ago, in another session, and it was just excellent. And I still remember all the big learnings. So, Professor Murthy, good luck for what's coming ahead. And again, best wishes. And I'm sure that you will do great things going forward. With that said, of course, thanks. I extend my thanks to Iman for taking the lead on this important initiative. To, of course, NHSRC, which is working alongside to help reaching out down the line to as many healthcare providers as possible. To Rotary, which has joined in this initiative, to the Indian Psychiatric Society, and clearly to our friends and I would say brothers from WHO and all the other partners who are here today. I think I wanted to make all these names because they speak to a very important concept, which is partnership. In the times where we are that are challenging for all, as much as I think we have learned to live with this as a chronic issue as compared to maybe a year ago, we still have a long way to go to address all what we are facing as individuals, as communities, and as societies, and also as professionals. And in this regard, coming together as partners is vital because each and every of us can have a job that brings a different value and a different element or way to reach out to those who may need support. I think the app is a great asset, and I can't wait to see it launch later today. But at the end of the day, enough remains enough unless we keep it alive, disseminated, updated, and complemented by other efforts which can really help the healthcare workers across the country who have one tool and many other tools around to cope with what they are coping with. It's hard to describe what healthcare professionals are going through. Their courage, their dedication, their commitment, and the fact that they continue risking their lives on a daily basis in this pandemic time. Sorry, I'm getting a message that there is some echo. Maybe I get going, if that's okay?
No, it is fine, it is fine. We are not getting...
Maybe it's just one of the participants. So I would like to say that at the end of the day, at the center of this is the healthcare workforce of India. And who knows, maybe one day this app goes viral and the app has no borders, and maybe it goes to other countries. There is always opportunities to share good assets with other countries. But for now, I think what we're looking at is an enormous workforce under an enormous strain and stress. And this workforce is the same workforce that has to deliver the core essential services for Indian citizens, for women, for children, and now also for the prevention, treatment, and management of COVID-19. I wish to add a final last point. Many of these healthcare providers are women. And as women in this pandemic time, they have to face additional burdens as well of having to take care of the families, as at the same time they have to deliver work, take risks, and go therefore under an enormous amount of stress and fatigue. So I think in doing this today, we are giving a tool potentially to hundreds of thousands of healthcare workers to access. I again look forward to this simple, usable tools, materials, voices, support that can help them cope and come through this situation. And once this situation is overcome, the app remains as a tool, because beyond stress, there is well-being. And we can always look forward as a tool that can shift and fine-tune its content depending on the needs of the situation. With these few words, I'd like to congratulate again everybody. Thanks again for having UNICEF with us today, with you today, and best wishes for the rest of the session.
Yes, sir. So now I would like to introduce the speaker of the day, Professor Pratima Murthy. She's a professor from the Department of Psychiatry and now currently assumed the responsibility of being a director of NIMHANS, Bangalore. She also, in the past, she has headed Department of Psychiatry and then Center for Addiction Medicine at the National Institute of Mental Health and Neuroscience, Bangalore. And she's an alumnus from the Bangalore Medical College and then from NIMHANS. She has also got a diploma in psychiatry from University of Manchester, UK, and is a fellow of the Royal College of Psychiatrists and Physicians. Dr. Murthy's major contribution have been in the area of human rights for persons with mental illness, addiction psychiatry, documenting the history of psychiatry and forensic psychiatry. Dr. Pratima Murthy led a team to look at the needs of women in mental hospital as part of project initiated by National Commission for Women. Earlier, she was part of the team that looked at the mental health issues of women in custody, which was supported by National Commission. Dr. Pratima Murthy has been working in the area of addiction prevention and treatment for over 2 decades now. And she has been the head of the Center of Addiction Medicine. And she was instrumental in terms of getting this center in NIMHANS. And since then, a lot of development have happened in terms of establishing the Center of Addiction Medicine. She has got many research grants from WHO, Ministry of Welfare, Government of India, United Nations Drugs Control Program, National Labour Organization, ICMR, Wellcome Trust, and so many other organizations have provided funds to carry out her research activities. And she has also published many articles in the international journals, both national and international journals, and shared her research findings and enhance the knowledge of many scholars. So it's been my pleasure to invite you for this webinar on psychosocial wellness for frontline health workers. And I welcome you from the Department of Psychiatric Social Work, Madam. And we are eagerly waiting to listen to you on the topic, mental health issues in healthcare workers during COVID-19 pandemic.
Thank you very much, Dr. Janathan. Greetings to all of you. It's a pleasure to be amidst you, and it's a very important occasion where you're releasing the app and having a very important panel discussion. Luigi, again, thank you for having me. I must also say hi to Dr. Gautam Saha and all other colleagues and participants at this webinar. Greetings. I've been asked to talk a little bit on COVID-19 and the impact on the mental health of healthcare workers, which is increasingly becoming so very important. And I'll try to do that in the next 15 or 20 minutes. We've known several pandemics in the past. We've known that In fact, we've also known about mental health consequences and how to kind of look after oneself and prevent the complications, for over 100 years now, particularly from the, impact of the Spanish flu. And we've also known what kind of precautions people need to take and how the public needs to be informed about the kind of precautions to be taken. These are notices from 1928 on what the public need to do in terms of their daily lives, the kind of precautions they need to take. And the point number 5, which is in Kannada, says that you need to not only look after your physical health, but your mental health as well. So, it's more than 100 years that we've been realizing the importance of mental health. And we know that COVID-19 is a global problem. Our learnings are global indeed, but our problems need to be local and contextualized. I've actually used, especially since this is, a program organized in collaboration with UNICEF, I've actually used a lot of children's paintings. We did these children's paintings. We requested children to participate in a program, and we had children, young children as well as older children, actually paint what they thought of lockdown and the pandemic last year. And I've used these illustrations from these children's paintings. So we know it's a pandemic which doesn't only affect the physical health, but also the mental health of people. It's not only a threat to health, it's also a threat to social, economic well-being. And the consequences of the pandemic for everybody are going to be much beyond the actual infective part itself. And everybody is affected, and the vulnerability particularly is influenced by the context in our lives. So all of us are aware of the initial phase of the pandemic where, we were taking all kinds of precautions. We were very worried about getting the infection. And that gradually changed, with the second wave of the pandemic. There were actually many more people with infection, many more deaths, many more people needing intensive care. And now we're in a phase where we're seeing the complications of COVID and are having to manage those complications. So, particularly in terms of, let us say, healthcare workers, and that's true also of the general population, the initial worries were about our preparedness. We were all preoccupied with our own personal safeties, concerned about the lack of, urgent responses. There was so much, information overload as well as misinformation. It continues even in the second wave of the pandemic, but perhaps the first wave of the pandemic was really, an overkill in terms of all this, And the other thing that healthcare professionals had to deal with are constantly changing guidelines. When I was the head of the Department of Psychiatry, in the last year, so every week, perhaps, we were getting newer guidelines on what to do and how to manage, patients who are having these infections or looking at the mental health. And I think that kind of change is also a source of great stress to the healthcare professionals. So in some ways, readiness burnout is something that we faced. We, of course, know that, the first line workers or the frontline workers, particularly the healthcare professionals, have to deal with so much. Of course, we know that other frontline workers also have a lot of stress. And now we're looking at, in fact, not just healthcare workers, we're not just looking at, people like the police, we're also looking at ambulance drivers, people working in cemeteries. So it's a range of professions that we're looking at, but certainly in the middle is the healthcare worker who has had to manage various aspects of the pandemic, both in clinical settings as well as in community settings. So obviously, these are extraordinary situations, and healthcare workers are also normal people exposed to these extraordinary situations. Although we have been looked at by, for example, all these young children as heroes, absolute people who have come to the rescue of the whole society, the healthcare workers themselves have not been exposed to situations like this in the past. Of course, we've known how to deal with emergencies, but none of us has, on a day and night basis, on a continuous basis, had to experience so much stress, which is kind of abated in between and then again increased. And that's caused a lot of mental health difficulties and distress among healthcare workers. We all know that as far as healthcare workers are concerned, one of the biggest fears is about getting infected themselves. Irrespective of the kind of protection they're wearing, there is always this fear of contracting the infection. But more importantly, it is the fear of transmitting it to other family members. Of course, in the second wave, we've known situations where entire families have been affected by COVID. And that's a real fear that many healthcare workers have gone through, particularly in the first wave, as is evident in not just in India, but in all parts of the world. There was concern about protection equipment, redeployment outside their specialization. We now know that many people, initially it is the intensivists and the internal medicine staff who are employed and who were looking after the COVID. But when the number of COVID cases increased, every other specialty was also drawn in to do COVID duties. And there is a fear that you don't know enough to actually handle patients like this. There is inadequate training, high patient load, and longer working hours. And this has taken a toll on many healthcare professionals. Although we have said that when you wear PPE, you should not be doing more than 6 to 8 hours duties, in reality, it has meant a lot more work for a lot of healthcare workers. And the third and most important thing, particularly for women healthcare workers, and I'm sure it's there for men as well. It's this balancing of the work as well as the household responsibilities that is a source of major stress for healthcare workers. And studies, of course, in the initial part of the pandemic were from other countries like China, the United States, and so on, where anxiety and depression rates were in excess of 30%. So almost 1 in 3 healthcare workers actually experience various kinds of anxiety and distress. And in the beginning of the pandemic, the rates of anxiety in India were about 17% and about 12% depression from various studies in different parts of the country. More subsequently, we did a study of more than 3,000 healthcare workers in Karnataka. And we found when we did a screener, you'll actually see that almost 1 in 4 healthcare professionals had symptoms of screening positive for anxiety, and about 1 in 5 for depression. And of course, it was in the people who were in the clinical front who had higher levels of this anxiety and depression as compared to people who were not in the front end. Although, again, amongst pharmacists and administrative staff, there was about 15% of the population, 14 to 15% who had anxiety and depression. It was much more. And clearly, as you'll see in this slide, people who had frontline COVID duties had higher levels of both anxiety and depression as compared to people who are working in general care. So obviously, when you're frontline, when you are working with the patient care responsibilities, the stress is likely to be higher, as are screenings for anxiety and depression. And when you see the kind or the nature of the fears of frontline workers, as I mentioned, even here, the major concerns were fears of getting infected. And this was, again, all these fears were higher among frontline workers with frontline COVID responsibilities, healthcare workers with frontline COVID responsibilities, fears of infecting their families and friends, fear of getting quarantined, because I think staying away, having to stay in isolation for, initially it was 2 weeks, then 10 days. These also are causes of stress, especially when you have small, houses, when you cannot really isolate yourself. These are major sources and real sources of stress. Worries about PPE, worries about the adequacy of training, and about the workload that healthcare workers faced. There is a phenomenon called the worried well, where people are very anxious that they might have a problem, even though they've taken adequate responsibilities. Here is Mrs. Y, who knew that she was adequately in PPE in terms of masks, gloves, and visors, but she would still become panicky and uneasy and get angry for trivial reasons, not be able to sleep. And even though she knew reasonably that she was following all the COVID appropriate behaviors, she would always worry about getting infected, keep checking with her colleagues, and so on. She managed to do her work, but her overall efficiency had reduced, and colleagues felt that her anxiety was not justified. And this is a typical example. And this can very easily become very abnormal, leading to dysfunction in sleep, in personal and social and occupational functioning. And of course, on the workplace, it can lead to absenteeism, impaired performance and productivity, rapid changes in mood, intoxication and the use of substances, impaired memory, and impaired daily functioning. So I think that's the consequence of untreated and unrecognized stress, anxiety, and depression among healthcare workers. They can also present with distress and anxiety related to COVID-19, as I mentioned, sleep disturbances, substance use disorders, and particularly for people with pre-existing mental health conditions, the stress of COVID-19 can have more serious consequences for the group. All of you are aware, I won't spend too much time on symptoms of anxiety and depression, in addition to sleep disturbances, crying spells, not being able to enjoy things that they usually enjoyed before, not being able to control their worrying, sometimes becoming very angry and irritable and having interpersonal problems, particularly with co-workers. And the worst of this can be when this distress actually converts into suicidal ideation. And certainly, this is something that is recognized as a serious problem among healthcare workers who are depressed. And some of the sources of this kind of anxiety and depression is actually dealing with people who have been very ill, seeing death up close, as well as having to deal with very often angry relatives who vent their ire when things don't go right on the healthcare professionals. And this is a source of great stress to the healthcare professionals. We also recognize that post-traumatic stress disorder is increasingly being recognized, particularly among those frontline care workers who have witnessed death. They keep having flashbacks. There is a sense of avoidance of any cues related to that. There is sometimes even a fear of being able to go back to that kind of work. So these are symptoms of post-traumatic stress disorder, impaired sleep, and having recurrent dreams about these distressing situations. How can we support healthcare workers? Proper support at the workplace is increasingly recognized as very important for them, protecting them against any infection, vaccination. And I think that's something that's happened very, very well in terms of offering vaccination to our healthcare workers. And of course, support for them when they get sick, support for their family members when they get sick. For example, at our institution, we made sure anybody who was infected was given an opportunity for isolation, was provided with a care kit, was asked to monitor their oxygen saturations, and if they got any sicker, arrangements to transfer them to another hospital was made. So these are all very important institutional mechanisms where we can support healthcare workers. We all know, of course, that we need to do a whole lot of self-care. And I think teaching healthcare workers how important it is to care for themselves, their family members, and for the patients that they see can be very effective, not only for COVID, but in the long run. Because unless we are physically and mentally healthy ourselves, it's very difficult to take care of the physical and mental health of the patients that we need to. One of the very serious consequences that everybody is concerned about is burnout, which is characterized by emotional exhaustion, a sense of depersonalization, loss of being able to care, to feel empathetic, and to be compassionate, and a decreased sense of accomplishment. And this is something that is a great concern, particularly with healthcare workers who've been on the front line, who, as I mentioned, have faced enormous levels of stress. So it's not just during the pandemic, but perhaps even after the pandemic, that they need a lot of support and hand-holding to actually come out feeling, not losing the sense of energy and their sense of motivation and compassion, but to come out as more caring and more humane and more competent individuals in the process. We must not forget that healthcare workers do not work in a vacuum. They're obviously also exposed to stress outside, maybe violence, maybe economic stress, interpersonal stress with family members, threats to their job, and certain vulnerable groups, particularly people with sensitive temperaments and pre-existing illness, can be at greater risk. And it's very important to provide them better support during these times. I will not to spend too much time, but it's very important to really understand that when we are looking at interventions for healthcare workers, we need to move beyond just individual interventions to also look at larger mitigating factors. That's also very important. At the individual level, as I mentioned, self-care is very important, ensuring adequate breaks for healthcare workers, proper sleep hygiene, keeping in touch with their relatives and friends, having alternate activities. Many people don't have anything else apart from their work. It's very important to have some other relaxing activity or hobby, making sure that they have an adequate diet, a healthy diet, adequate exercise, something we recognize as very simple but very necessary for our physical and mental health. Increasingly, if a person is spiritually inclined, spirituality can be a very important aspect of keeping oneself calm, making time for themselves and their family, proper time management, balancing work and home life is also very important. And professionals also need help. In fact, just yesterday, I was asking one of my colleagues to see a young doctor and her mother who've lost two family members and are going through a lot of difficulty themselves. So this young doctor, unless this doctor is supported, is going to find it very difficult to really be able to give quality care to others. So it's very important that we take care of each other and provide that kind of support. Problem solving, again, when you have multiple things happening together, looking for solutions, seeking advice, deciding which response to choose, and following up on this and seeing if it works or not, and choosing another solution are very simple ways that healthcare professionals need to learn to be able to handle things effectively. We need to enhance social support for all of them, not just from their friends and family, but others in the community who might be able to help, organizational support for them to be looked after properly. The worried well, fear should not be dismissed. We should make them feel understood. We should provide them adequate material and proper information, perhaps point out the discrepancy between the symptoms, their symptoms and the symptoms of COVID-19, and of course, teach them ways of dealing with this problem. Substance use is a growing problem, including among healthcare professionals. So it's important to counsel them about not using substances to deal with stress or sleep disturbances, the possibility of substance withdrawal. And this is something that we need to be aware of across all healthcare professionals. We try and identify the stress. We explore for distress, for sleep disturbances. We advise them to stop or cut down. We teach them how to deal with anxiety and depression so they don't need to turn to substances to deal with their problems. Expressing empathy, emphasizing self-efficacy, telling them quick-line supports for tobacco, for example, simple ways of relaxation, dealing with insomnia, and of course, professional help when it's necessary. Sleep disturbances are perhaps the most frequent problem among healthcare workers. They can be initiation disturbances, they can be frequent awakenings, early morning awakenings, and sometimes atypically, they may also have excessive sleep. All this may impact their work performance and need to be addressed. So these are the simple tips to address insomnia, even among healthcare professionals. I think this is something that they should know and be able to teach their patients. I mentioned post-traumatic stress disorder, hyperarousal, anxiety, intrusion, flashbacks, emotional distress and avoidance. And this is something of a growing concern world over. Finally, what can organizations do? We need to promote awareness about mental health, awareness about stress and stress management. We need to have team meetings where mental health issues are constantly discussed, especially issues of burnout, stress, anxiety, and how to prevent it, how to improve psychological self-care. And we need to have a protocol for managing our staff with healthcare problems. A good communication between people, guidelines for testing, quarantining, returning to work, debriefing when there is a situation helps to strengthen the team of bonding. And a grievance policy in organizations is also very important. Supporting each other, providing a buddy. And this is something that has emerged as very important for healthcare workers. And referral to a specialist is something I already mentioned. So we have a responsibility to come out both mentally as well as physically well out of Corona. And the way to do it is really to make sure we take care of our mental health. We need to have a greater focus on health, social protection, and public services for everybody. We should be aware of the economic consequences. We should be able to use digital technology to enhance the training and capacity of healthcare workers so that they can feel more effective when they have to see patients and deal with this. We need to focus on all aspects of mental health and well-being, not just the physical aspects, not just the emotional aspects, but perhaps the social, the occupational, and other aspects of mental health and well-being. Humanity is really being tested. And I think the way we can come out of this challenge is to make sure we are properly informed, we support each other, particularly in terms of emotional support. And there are lots of organizations. I mean, I think our organization is one where we tried to try and help patients to our healthcare workers to the extent possible. And that is possible by team building, working together, working across disciplines, and hopefully together we can come out of this pandemic stronger and more resilient. I've taken some of these pictures, as I mentioned, from the Heritage Museum, and it's actually been a wonderful experience to learn from children how adults and healthcare workers can actually look after their own health and emerge, fairly unscathed from this pandemic. But I also need to leave you with the warning that long-term consequences also need to be looked at. Thank you very much.
Thank you, madam, for your wonderful insights. So now I'm just opening up for 2 or 3 questions from the floor. In case if you have any questions to ma'am, we can ask, or it can be put in the chat box so that I can read for ma'am.
Good afternoon, ma'am. I'm Vivek, a health specialist from the UNICEF India Country Office team. I would also like to congratulate you on your appointment as the director. Ma'am, while we are going to go into this panel discussion soon after your session, not sure if you would be staying on with us. So one message that I want to ask from you as a question, looking at the panel today, that we have Dr. Saha from the Indian Psychiatric Association, we have our WHO colleagues, we have 2 of your centers, the Integrative Yoga Center, and then now we have Rotary joining as a partner. So what is your reflection on what all these different partners can do together? Because one of the theme for this year by the World Health Assembly is protecting the health and care workers, and that is by investing and also together in supporting them. So your reflections on that, ma'am.
Yeah, thank you very much, Vivek, for raising these issues. I think we've realized now more than ever before that we cannot work in silos. I think it's important, and that's why, Janardhan, I'm so glad that you made that opening remark, that we need to bring whoever it is that can provide solutions together. And we need simple solutions. And that's something, again, that we've learned. So whether it's in terms of the Indian Psychiatric Society coming forward and perhaps, getting involved in training of people, of healthcare professionals to actually, look after themselves and to be able to provide care. And I know that the IPS has already done that in terms of having free counseling and so on. Yoga, we know, is can be a very, very important tool for self-care. And therefore, learning how to manage one's breathing, how to calm oneself can be very, very effective self-care methods. So I think it's very important that people from different professional avenues come together, and we have the World Health Organization here. So as I mentioned, I think this is a time when we have to reflect what's going to happen in future. And if we don't invest in our mental health right now, we are definitely going to see, the negative aspects of it. So I think it's very important to look at that now, provide, solace and counseling to people, so that in some ways it's preventative for future mental health problems. So whatever is being done is, in my ways, not enough. We need to do more. We just not only need to do more of the same, but I think we need to expand it. So some organization like the Rotary has a fantastic role in actually perhaps being able to reach out messages into the community, into actually helping people, connect people with resources. So I think there's important roles in it for everybody.
There is one more question from the participants. What can be done on a daily basis to keep motivation of clinical team working in COVID wards?
Yeah. So one of the things I will tell you is of course, we don't have acutely ill patients, but we have our patients, are chronically ill patients who develop COVID. And that's a big challenge because, as you know, world over, there have been high rates of infection and death in close communities. So I can tell you that one of the things that we did when we had these COVID outbreaks, both last year and this year, is that every day we'd have a debriefing. Every day we'd find out what is it that we can do around individual cases. How can we support our residents? And we've also had residents, for example, who've been ill. We've had nursing staff, we've had attendants who've been ill. So supporting each other by, discussing cases, by discussing problems is very important. This is the debriefing. The other thing is something that we've now initiated with our residents, having a buddy system, so that, there is somebody who kind of is looking for you, is able, if not on a regular basis, actually checking on you, so that in case you're having problems, there's some, they can kind of, escalate it to somebody else and get help. Very often, we're the last persons who identify these problems among ourselves and actually reach out for help. So I think this is another system that can do that. The other way of, of improving motivation of teams is to recognize people, is to value our people, recognize them for something that they've done very well. For example, if you have a team which is in charge of testing, or you have a team which is in charge of, some other aspect of maybe looking after the attendance or the security, who are looking after the thing, recognizing them, everybody, for the value that they do. And now we know, as I mentioned in my opening remarks, ambulance drivers, cemetery workers, in some ways, our healthcare team has expanded now. And if an ambulance driver talks to you well, you're likely to feel better and calm down when you're looking for a hospital. I mean, there are so many aspects to this. And I think everybody working together is tremendously important. And if we do not recognize the importance of working as teams and supporting each other now, I mean, this is an absolutely important opportunity, an opportune moment for us to understand how important it is for all of us to work together and support each other. And I think that kind of support and ventilation itself can prevent a lot of the stress escalating into syndromes of depression, anxiety, or post-traumatic stress disorder.
Thank you, madam, for your wonderful insights, what you have given and shared your experiences. I need to just say in this platform, the invitation what I have sent to madam, it was all through chatting and emails. And even though madam, like yesterday, took over the new position, she was busy, but she kept her commitment. And thanks for the commitment, madam. And
Thank you.
you reminded about, like, I have to just remind you in the morning. Before that, I got a message that you know about it and you are going to join. So thanks for your commitment. And from the Department of Psychiatric Social Work, I would like to thank you for this wonderful talk. It has given us a lot of insights for us, and it is the time for us in terms of working in terms of multisectoral convergence is something we need to look forward. And that is a beautiful message what you have given. And let us work in terms of that convergence and enhance the people health, mental health, and let us make everyone. So with that message, I would want to end this session.
Thank you. And I'm just going to have to leave. I wish the rest of the panel great success, and I'm sure there'll be a lot of wonderful discussion, which I'm going to miss.
Thank you, ma'am. Thank you, ma'am. It is an excellent presentation. Congratulations again.
Thank you very much, sir. Bye-bye.
Now it's over to Vivek, sir. Vivek Virendra Singh would take over for the panel discussion. So he's going to invite the panelist.
Thank you, Janardhan sir. And at the outset, I must thank you and the team with all due regards to Dr. Murthy ma'am and Luigi, our Chief of Health, for their deliberations. But Dr. Janardhan, who is a professor at the Department of Psychiatric Social Work, we have seen that how over the period of last 1 year, when this began as a concept and when we were in the first phase of pandemic, he has held on to this very important topic and has consistently, with his team's support, come out with different material which is now informing the program, at least in the public sector more so, and I'm sure with more partners coming in, reaching out to all the health and care workers. And I'm very happy that Murthy ma'am has reminded us that it is the health and care workers beyond just the traditional health workers that we see. And that was also exactly the theme for this year given by the World Health Assembly. So with that, I am I'm honored and privileged to be with some eminent panelists today. And I'm going to introduce not just any order, but all of them are equally eminent. And as mentioned by Dr. Janardhan, we have the president of the Indian Psychiatric Society, Dr. Gautam Saha. Welcome, sir, to the panel. And with this, I would also like to remind the audience that, the Indian Psychiatric Society last year had committed that all the psychiatrists of the society, they would be volunteering their support for any counseling required for health and care workers. Thank you so much, sir, and we'll listen to you in due course. And then we have Professor Janardhan sir himself. He will be talking about the actions taken at the department and all the efforts that have gone into this app also, which is being released by his team today. Then we have Dr. Arti Jagannathan, who's also an associate professor and looks at the Integrated Yoga Center. Welcome, ma'am, to the panel. And then we have Dr. Bal Inamdar, sir, from the Rotary, and who leads the health vertical for the Rotary India. Very welcome to the session, sir. And then we have our colleague and my previous colleague, Dr. Anant Kumar. Very happy to know recently has moved to the National Health System Resource Center of the Ministry of Health. So Dr. Anant, welcome to the session, and he will be speaking about NHSRC's collaboration with NIMHANS to take the discussion to all the frontline health workers in the country. And last but not the least, my own colleague from the UN, Dr. Atrey. If Atrey, you are there, welcome to the session. Dr. Atrey Ganguly is the National Professional Officer for Mental Health and Substance Abuse at the WHO India Country Office. So very happy to be moderating this panel. And once again, a warm welcome to all eminent panelists. I would like to begin my first question to Dr. Gautam Saha, sir. So, sir, just a reminder that your predecessor, Dr. Professor Dalal, he was here with us.
Oh, acha. I made a small presentation. Can I share it before?
Sure, sir. While you're uploading, so just to give you a background,
I share this slide.
Dr. Dalal, sir. Yes, sir. You can share, please.
Yes.
So, sir, while welcoming, we wanted to mention that it was your society which had sort of inspired the feature of the app where, it suggests to people in need if they want some professional help. And it was your society which last year, during the first phase of the pandemic, had said that we would volunteer for any support required. Thank you very much, sir, and welcome for your intervention.
Thank you, sir. At the outset, I must congratulate Rotary Club, UNICEF, and definitely our own NIMHANS for organizing such an excellent program. I'm not taking much time because I thought there should be a small presentation in the initial part because the Indian Psychiatric Society and response to COVID-19 pandemic. At the outset, I also tell what is Indian Psychiatric Society. lots of people are non-psychiatric and came from different areas of mental health. So I want to introduce Indian Psychiatric Society, which began in 1947 with 15 founder members, has now grown to a membership above 7,500 specialists. The IPS currently represents the largest society of the mental health professionals in India and works on health advocacy and social activism and policy formulation and the medical research in the field of mental health. This is last time you know that with the Niemann's Bangalore, IPS published this guideline for psychiatrists in COVID-19 pandemic, and the then president, Dr. P.K. Dalal, has got an important role, and Dr. Gangadhar, Dr. Pratima Murthy was in a very much instrumental along with Dr. Suresh Badamat. This is the Psychiatry Operational Guideline 2020 because you know that it was published in 26 May 2020, and it really helps a lot during this COVID period. And the instrumental again, it was done by IPS and Niemann's with the Telepsychiatry of India, and instrumental again, Dr. Suresh Badamet, Dr. Gangadhar, Dr. Pratima Murthy, and all the team Niemann's. We have done a symposium on behalf of Indian Psychiatric Society this year, 2021, among the SARC countries. All the SARC countries, presidents and secretaries are invited, and there is a discussion, our experience, lesson and learned, and the way forward, how we proceed, what are the things we have done during this pandemic situation regarding COVID. We have our own COVID-19 and mental health task force in Indian Psychiatric Society. We have done lots of programs, even the COVID, along with the COVID warriors, and how to face the challenges regarding the mental health in the COVID period we have done. And also there are lots of studies done by Indian Psychiatric Society. This was one of the psychological study, impact on COVID-19 lockdown and outline survey from India. The key author was Dr. Sandeep Grover, and it was done under the leadership of the P.K. Dalal last year, the then president. It is found that the anxiety disorder is 38.2%, depression is 9.5%, either depression or anxiety 40.35%, and moderate level of stress. It is so common about 2/3 of the population, that is 74.1%, and the poor well-being is 71.7%. During this COVID period, during my presidency, we have form a steering committee of Indian Psychiatric Society along with Indian Association for Social Psychiatry, where I am the chairperson and the co-chairperson is Pratap Sharan, and other members are our vice president and the secretaries. We have planned, as because the WPA wanted to support in this COVID period for the mentally ill patients, and we have working together that we will do something for these situations. This is the counseling to lockdown citizen from IPS we have done in different states and zonal level. Even Niemann's has done a wonderful job during this counseling in the telepsychiatry. This is our telepsychiatry subcommittee, where we are within 1 to 2 days, we are launching this one single number, which will be available 24/7 hours and in all languages, not only in single language, English, Hindi, or any other, in all Indian languages. And almost around 600 volunteers will participate, and it will be named as telepsychiatric counseling, and the call directed to the respective volunteers to particular region. So we can cover all over the countries by this. And we also collaborate with the GAPIO, Global Association of Physicians of India. It will be done telecounseling for the mental health professionals only all over the world. And we are a partner of that. Recently, we have signed a memorandum of understanding with them. And we have written a letter to the Government of India regarding the position statement of COVID-19, and letter to the Prime Minister also regarding the violence on care workers during this period, and later to the Niti Aayog chairman also suggestion and request the inclusion of more high priority group for vaccination with the person with the severe mental illness. You also know that it has been started in the Maharashtra. And later to the Press Council of India, look into the matter to ensure that the dignity of a doctor and the medical discipline must be upheld. And again, to the mental, we have written to the letter in the COVID-19 vaccination just few months ago, and the media matters and mental health during the pandemic from Indian Psychiatric Society and our task force. We have written the letter, and the last, the media matters and mental health. There is a letter written by Dr. B.N. Gangadhar, Dr. Potima Murthy, and me, and Dr. Rajesh Sagar, that whatever the news they have written, they should take care of the mental health of the general population. And this is the Indian Journal of Psychiatry, which contributed only for COVID-19. It is on global perspective. The Professor O.P. Singh is the editor of the Indian Journal of Psychiatry. It was the September 2020, volume 62, issue 9. And thank you so much for patient hearing. This is on the response of Indian Psychiatric Society to COVID-19 on behalf of Indian Psychiatric Society. Thank you so much.
Thank you, Dr. Shah. And I must mention that, from the last 1 year, we have seen that how, and it is very heartening to know that Indian Psychiatric Society and also collaboration with the chapter of social psychiatry, and how your 7,500 members have been instrumental and have grown your support for free for citizens across the country. And we would also listen from Professor Janardhan that how these members will also contribute to the healthcare workers who would be using that app. So with that, I would now request Professor Janardhan to tell us in brief about the evolution of this program, and also you wanted to share the details of what all has gone into the making of one of the tools which also you're launching today is the Share Care app. Over to you, Professor Janardhan. So you have a presentation?
It's a very small presentation. I'm going to...
Not at all, please.
See, the whole idea of developing an app started 1 year ago. So we had discussion with various groups, and various people supported for me in developing this Share Care app within NIMHANS and outside NIMHANS. So within NIMHANS, from the Department of Psychiatric Social Work, that is my own department, I had few colleagues whose name I had taken earlier, and then from Department of Clinical Psychology, Department of Psychiatry, and then Department of Child and Adolescent Psychiatry, and then from our yoga center, they all supported this initiative. And what I'm going to share today, it's been developed by everyone. So the app name, what we have kept is, it's called a Share Care. So this app is about healthcare providers of COVID-19. So they are facing many difficulties during this pandemic. So we recognize those difficulties, and we wanted to answer some of those difficulties through self-help. How it can be handled is something we are developed as part of the app. So they have been providing care for trauma and caring for critically ill patients, long working hours. It's been impacting their family life and their mental health issues. They are not able to spend time with their children, and how children need to be monitored back at home when this person is at workplace is something we have kept as a context, and then developed our app. So the Share Care application has been designed by NIMHANS and UNICEF to address the psychosocial issues and to provide for healthcare providers of COVID-19. So it's a joint partnership between UNICEF and NIMHANS in developing this. So this app has 4 divisions. The first division is about assessment. This application is available on all smartphone stores, and with app, health workers can assess their stress, insomnia, and distress level through the self-assessment questionnaire. So we have self-assessment questionnaire, which also give them the result. and they would know the level of distress what they have been having, or the stress level and sleep disturbances, so that they can make a decision whether they need to seek help from somewhere. This app also has a second division. We have a lot of self-help videos. Around 18 videos have been developed on self-help. So yoga-based intervention, so that the participant, the person who is using the app, can practice yoga, which is 2 or 3 minutes yoga exercises have been shown, and then relaxation, how to do relaxation themselves. The commentary would come, and then they can practice. And we also have given some cartoon videos where they can make plans in terms of how to take care of children when they are at home, and how to take care of adolescents during the COVID-19 lockdown situation. The third part of the app is about self-help question and answer, frequently asked questions, where a question has been imposed and then the answer has been given, so that again the frontline health workers would be able to read and understand what they need to do and how they need to handle the situation, rather than just depending upon others in terms of getting the inputs. They themselves can get inputs through reading this. The fourth part of the app is chat box, where people can raise their questions, and 24/7 we have people who are going to look at those questions and consult the professional in order to answer those questions. And we also have a link in terms of the resource people throughout the country. So we would like to thank Indian Psychiatric Society, who had issued a list of professionals who agreed to be volunteers and to support people in need. So that list, it will be part of this app. And people whoever want to talk to them, they can talk to them directly, or we can be able to link to the resource person, and the numbers can be exchanged, so the resource person himself can talk to them, so that a platform is created for people to vent out their feelings and present their problems, so the professionals can answer. Similarly, we had a list from the Indian Psychiatric Social Work Society, which was given to UNICEF. Again, that list is going to be part of this app, so that people can be contacted, and the resource people from each state being listed out, and that list is available in the app. And people can contact either directly, or they can direct the question to us, and then we can contact them. So what are the benefits for healthcare providers by using this app? Is it's easy access of information, quality services for those in need, in comfort of one's own home, rather than just visiting to a professional. Confidentiality would be maintained, and timely support would be planned, and people would be immediately supported, so that they can come out of their either anxiety or any other mental health issues, or stress levels can be handled in a better way. So with this, I would like to thank everyone who had been part of this app development. So over to Vivek sir now.
Thank you, Professor Dr. Janardhan. Actually, I would like to congratulate his team for the sustained efforts for the last 1 year. You know, a lot of thinking has gone behind this, and I would be doing injustice if I do not mention the wellness portion, which we are most excited about. So, you know, someone gave an example, and I see Bal Inamdar sir here, that, for example, Rotarians or anybody else who wants to contribute, we can contribute to the wellness portion of the app, where the content can come, you know, some motivational content, let's say from celebrities, or if there is even a paid wellness class, there are vouchers which can be put there for doctors. So let's say if there is a doctor, somebody puts an IMA registration number and gets the amount is sometimes minuscule, let's say 1,000 rupees, 1,100 rupees wellness voucher. But those are the kind of things, it is the idea that the wellness portion will have content, both audio visual content, motivational content, and maybe small incentives that can be given to health and care workers to keep them motivated and keep them well. And God forbid, if the need comes, the fact that the demand has to come, that recognition that, you know, being psychosocially unwell and needing support is absolutely normal in such kind of stress situations, and coming forward to seek that support with confidentiality, and as mentioned, at the comfort of their home, and because they're hooked to the phone anyways. So let's see, I mean, this is a very good step forward as a beginning as we are taking it. And now I would request Dr. Aarti We have heard from her in the last panel that what yoga can do, how it is useful for de-stressing especially. But what are the kind of content that your center develops and which will also go in this wellness portion of the app? Over to you, ma'am.
Thank you, Dr. Vivek, for giving me this opportunity to be part of this initiative. It's been extremely exciting to be part of this initiative from the last year when Dr. Janardhan discussed about this protocol and his collaboration with UNICEF. I laud UNICEF for supporting this work, a very important work, which I believe is important. From the role of yoga for improving psychosocial well-being, I'm a psychiatric social worker, and I'm associated with the Department of Integrative Medicine as part of research projects and also as a freelance consultant who helps them out in various projects. And over the last 1 year, I think the department has been more active than ever during the COVID pandemic. The COVID pandemic has brought out the fact that integrative medicine and yoga especially is extremely important in improving respiratory health. There have been a number of case studies that have been published, especially from the Swami Vivekananda Yoga Anusandhan Samstha, SVYasa University, which have shown that people who have been in intensive care units, as well as people who have had severe case of COVID symptoms, have improved by performing certain breathing practices, or what you call as pranayama, as part of yoga. And these studies, along with a number of other studies done by the Central Council for Research in Yoga and Naturopathy, that's the CCRYN of the Government of India, Ministry of Ayush, which is still running, shows that yoga does help in improving the overall physical as well as mental health in all persons who are affected with COVID, and of course, in general, improvement in well-being also. What is important is that to ensure that a standard protocol is followed, especially during the COVID pandemic, the Department of Integrative Medicine came out with a number of initiatives in collaboration with the Department of Psychiatric Social Work and the SVYasa University. One of the first was development of tele-yoga protocol for COVID-19 patients, which has been published in the Asian Journal of Psychiatry. And we've developed a standardized protocol for yoga practices which can be given to clients with COVID-19. And it has shown that it has helped improve their respiratory health, as well as helped improve their overall mental and physical health. The center has also been providing services to our staff and students who have been affected with COVID-19 during the entire period of the pandemic from last year, March. We have also had a number of other research initiatives along with the Ministry of Ayush. One of it is the development of the tele-yoga guidelines. It was an advisory of tele-yoga services and practice. And only recently, last 2 days ago, it has been approved as the guidelines by the Ministry of Ayush, and will be put up in the website shortly as the final guidelines for tele-yoga. This was developed in the context that it was extremely important to provide yoga services, but because of the nature of COVID and the need for isolation and possibly inability to have physical sessions, one-to-one sessions, it was important to have tele-yoga guidelines, which possibly could establish certain standards on how these practices could be developed. Another important initiative was development of a tele-yoga checklist, which assessed how the performance of the person on the tele-yoga session, the performance of the therapist in the tele-yoga session, so that it could see that there were certain standards met. Another very important initiative which was taken about was the development of a protocol for BNYS doctors in improving psychosocial rehabilitation services for COVID-19 patients. The entire thought process by the Ministry of Ayush and CCRYN was that to bring in more number of healthcare workers, especially the BNYS doctors, into the healthcare fraternity so that they could provide services to COVID-19 patients. It was observed very clearly, especially during the second wave, that our health infrastructure didn't seem very adequate to handle the mass number of people who got affected with COVID. And hence this initiative was taken to release the protocol in April of this year. And we do plan to continue with providing training to BNYS doctors so that they can be equipped in psychosocial rehabilitation. We do rehabilitation in 3 aspects: the naturopathy and the diet aspect, the yoga aspect, and the psychosocial mental well-being aspect, which they will be trained in so that they could go into the community and take care of COVID-19 patients. With these initiatives and the services being provided by the Yoga Center, I believe that we are at a platform today where we can help reach a number of persons affected by COVID through the teleservices, through the protocol of BNYS, and through the various service initiatives of the Department of Integrative Medicine, Psychiatric Social Work, in collaboration with the Ministry of Ayush, so that this could go a long way in helping deal with the COVID pandemic. Thank you.
Thank you, Dr. Aarti, and I'm sure the users will benefit from the content from your center, and there would be also continuous development of more based on evidence. So with that, I would now like to move to our next panelist, Dr. Anand from the National Health System Resource Center. He's also representing NHSRC, and we must mention that his team lead for the community processes and primary healthcare, Dr. Bala Subramaniam, he was also supposed to be here, but he's also called for an empowered group meeting. So welcome, Anand. And the question I would like to ask you is that there is plan of NHSRC to take this dialogue to all the frontline health workers across the country. And it's not an easy task, but a very important initiative that NHSRC has taken up, of course, in collaboration with the team here at NIMHANS. So we would like to know more from you about the plans. Over to you, Anand, please.
Thank you so much, Vivek. It's nice to see you after a long time. Yeah. So thank you so much, NIMHANS team, for giving me this opportunity. So can I share the PPT, please?
Please.
Sorry about that. And thank you so much again. And it's been fantastic to see all these insightful presentations, and it's been a great learning experience to me. When we thought about this important issue of addressing this need of stress among the healthcare workers, the biggest challenge was how do we able to reach out to all the frontline health workers across the whole India. I would say NHSRC is best positioned to reach out to the health workers across the whole India because of the. If I shared the PPT. So I would say NHSRC is best positioned to reach out to all the frontline health workers across the whole nation, because we have a wide countrywide network of individuals and institutions. We have been part of the capacity building initiative as part of the rollout of Ayushman Bharat Health and Wellness Centers. And we have the established mechanism of capacity building through our cascadal approach, where we train a pool of national level trainers and then state level trainers who in turn train state and sub-state staff until the primary healthcare team. And we also are able to leverage the existing program structure from the government, right from the state level through CP nodal community processes nodal officers, CPSC nodal officers, and ASHA program officers. Through them, we roll out the implementation, whether it's capacity building or any consultation initiatives. So this was a tripartite initiative of NHSRC, NIMHANS, and UNICEF. The plan is to have 5 zonal webinars, 2 webinars from Hindi-speaking states, 1 from South Indian states, 1 from North Indian states, and 1 webinar in the other states and union territories. So we chose to do it at the zonal level to make sure we have good number of master trainers at the national level and not too many so that we can handle them. NHSRC will be organizing the webinar, and NIMHANS and UNICEF will provide the training resource support. So in each zonal webinar, there will be 6 state level trainers and 4 district level trainers, who in turn train state level trainings and reach out to all the frontline health workers in each state. So these trainers will have experience in either psychology or psychiatric social work. And once we have this master level training, the rollout of the trainings will happen in each state. So this is the just a representation. 5 zonal webinars. From each zonal webinar, there will be 6 state level trainers and 4 district level trainers. And this whole thing will be coordinated through the state level nodal officers, ASHA program from ASHA program, Community Process Program, and the CPSC program, and who in turn roll out the whole training in all the states of India. Thank you so much, Vivek. Thank you, Nimans.
Thanks, Anant. Thanks, Anant. And it's very encouraging to see that how it is still possible to reach each and every frontline health worker with this message that their psychosocial well-being is important. And let's see that how we are able to reach to them with some of the interventions. So with that, I would now move to our next panelist, Dr. Bal Inamdar, sir, from Rotary. Welcome to the panel, sir. We would like to know from Rotary that looking at the theme of this year from the World Health Assembly, as we see that protecting the health workers, investing in them and doing it all together. So it is clearly mentioned that health workforce needs to be supported, then they need to be protected, like with the equipments to prevent infection. This time we have seen they need to be supported, protected, and then motivated, to keep them motivated, maybe some recognition of the good work that they are doing in spite of the challenges. And then, of course, equipping them many a times, for them to function well on the front lines, the right kind of resources. So what role do you see that, an agency like Rotary can do, and individual Rotary clubs and Rotarians, because you also represent the health team? And if you would also like to highlight some of the initiatives that can immediately support this program. Over to you, Dr. Inamdar, sir.
Thank you, Vivek, for inviting me on this panel. And let me also thank Nimans and UNICEF, Rotary, all 3 of them, who are apparently, from your backdrop, it looks like the 3 of us are going to come together and work. And I really welcome this step of coming together. For one reason is that I think the age of silos and age of working singly has gone long back. What is important is that we should come together, and because every one of us has different synergies, every one of us has different specialities, and especially in a pandemic situation here, it's important to realize that as Martin Luther King says, that we might have come from different ships, but right now we are in the same boat. So it's important to realize that all of us have come from different ships with different expertise, but now we are here, and that is to a great extent good thing to happen for healthcare workers and even communities at large. In India, it's typically healthcare workers are always stressed with a pandemic or no pandemic for 2 reasons. One, we are always taught our doctors that doctor is good, who goes beyond his call of duties, sacrifices himself for the patient. He is a very good doctor. And the second one that we always think, is that doctor is good, who go beyond their duty, beyond their call of duty, and beyond their value systems, and sometimes the value of his expertise that he gives. That doctor who reduces his charges and takes less and then then helps patient, that doctor is good. We have a contrasting thing, and especially in India, when we have such a deficient and healthcare infrastructure spending from government, this really comes to the fore. So doctor is always stressed. He has to balance his family, he has to balance his workplace, but at the end of it, in such a situation as pandemic, he is overstressed, and that's the reason why we are seeing such a mental array of I won't say diseases, but compromises that a doctor has to do. Having said that, let me also say that on the other hand, as doctors, and I'm so very proud of doctors who are frontline workers, we are very, very happy to work and assist patients, whatever the constraints are. And when in such happiness, we find that our own personal choices get compromised, that's the time the stress comes through. And there are various studies which I have seen now also. A number of psychiatric associations have come out with studies. Anywhere from 27% to 78% doctors' mental health is compromised, and that's not a good thing to have. And that is why when I think of doctors, especially why it should happen, is that one is that whatever they are, the scant resources they have to allocate equally to people who need it, but somehow they can't. And we have seen examples of this, that even though if there are two similar patients who are COVID afflicted, and then we find one is an elderly, one is a younger, and in Italy, number of times we have seen this. The choice falls of allotting those resources to younger patients rather than older patients, looking at the future. And this is very traumatic for a doctor, very traumatic for a doctor. So there are ethical considerations, and hence that definition, that term, what is called as moral injury, has come up, because doctors are ethically and morally compromised many times this. So let me now come to what Rotary has done. I think that's the main point that we are here. So I'm going to divide briefly into what Rotary has done so far and what is the way forward. So the first thing, let me inform you that Rotary has done on three different aspects, three different areas. One is a protective interventions that Rotary has come out with. Second, the motivational intervention, and the third is an infrastructural intervention. And all these three interventions, we have gone immediately into a disaster situation. When we realized that COVID was coming in a year back, it was really, on the first wave, it really went through, the whole India went through, was submerged under COVID. That's the time Rotary came out, and within days, we came out with assistance close to almost 100 crores, within days. And that's what Rotary's strength is, because we have numerous districts, numerous clubs all over India who immediately came through. You know, our basic motto is service above self, and we work with that. And especially the incoming Rotary International President, Mr. Shekhar Mehta, he has given a clarion call that serve to change lives. And through that, and empowering the girls, and through that, we are going to work enormously in future and near future. So the first thing is that what we did for the as a prevention, as a protective interventions, we immediately came out with numerous donations of PPE kits, masks, sanitizers, medicines, and I know at least 2-3 sites where they told us, please don't send now. This is enough. Please direct your donation to somebody else who may deserve it. So to that extent, we were so quick in assisting, and that is the strength of Rotary. That is the strength of Rotary, because we have people who can really come with a lot of assistance. The second area where we immediately went into, realizing the stress that doctors and health workers are, we started something called as COVID warrior, COVID warriors being felicitated. And across India, more than 10,000 COVID warriors, not necessarily doctors but others, were felicitated in good meetings, where we called somebody who is say a chief minister or a deputy chief minister or a health minister or something like that, or some of the outstanding organizations like UNICEF or Indian Psychiatric Society, or even our Indian Medical Association, and we felicitated them. Across India, more than 10,000 we felicitated, because we realized that it is important to support these doctors mentally. They are the frontline workers. Remember, a doctor when he's working in a COVID, compared to a normal doctor, he is a person who does not know whether tomorrow he is going to be afflicted with COVID or not. Especially in the first phase, especially in the first wave, without any clear support, without understanding what this novel virus was going to do, we still went ahead and worked. And numerous of my colleagues, we got afflicted with COVID. Number of my colleagues have expired because of this, and that's a very sad situation. Nobody to blame here. Believe me, nobody to blame. We don't want to blame. We don't want to go back and say this should have happened and that should have happened. No, we don't want to do that. But we have to have a reality check. And that reality check made us realize that we have to understand the COVID So numerous researches took place on one side across the world, and we realized that COVID is not necessarily a pulmonary disease, but it's more of a vascular disease, and that's how the course correction came up and the death rate went down. Second wave came through, again we lost numerous doctors who were frontline workers, and obviously I can only imagine what must have happened with these young doctors, their families, and what the stress that they must have gone through. It's a terrible situation, and Rotary was there at that time, and in future also we will be there to help us. The third thing was the intervention infrastructure support. And with numerous places, we came out with COVID hospitals, we came out with donation of number of beds, we came out with number of ventilators, we came out with number of oxygen concentrators recently, COVID ambulances. Immediately within 2 months, we started giving COVID ambulances, because in those days the ambulances were risky. We could not carry the COVID patients, but we came out with COVID ambulances. We had a tie-up with Mahindra & Mahindra, who prepared those ambulances with a screen between driver compartment and the patient compartment, and that's how we immediately started donating ambulances. Then we started organizing and assisting in seminars like this seminar. We constituted a cell which we started creating number of collaborations, and this is what we did. And this is what Rotary has done, and Rotary will continue to do. Rotary, we know that we are not a technical organization. We know that we are not a scientific organization. But it's very, very important for us to realize that we are that organization which purely scientific support is not the only support which health workers and others need. Purely technical support is not the one which they need. They also need the support which is the backhand support. The back office support, if you have to, I have to give that term to this. And this is where Rotary is done. So what we are going to do in future, the numerous collaborations, numerous partnerships we are forging. And let me give an example of 2-3 partnerships which here we are going to start. One is with NIMHANS, and we have already talked about the numerous ideas in NIMHANS, and I hope that we come through, we go ahead with partnering NIMHANS across India, because we have a footprint across India. And NIMHANS is an outstanding organization, and Indian Psychiatric Society also can come in along with us, and would very much welcome. I think, as I said, time for collaboration is here. Time for working singly is gone. Unless we collaborate, unless we cooperate, unless we coordinate, we will never be able to tackle this pandemic. So we have to create all those synergies coming together. The second partnership we are going to forge with UNICEF, and Vivek, we have talked on this. And we have had numerous meetings, and I hope we'll go through with this, because we are looking forward to getting ourselves associated with organizations like UNICEF, NIMHANS, IPS, and so on and so forth. And the third one, which I would very much like you to understand, that remember, we have numerous Rotarians across the world. And we are going to, we in fact started just at the start of the COVID, or before COVID, we started on a collaboration with initiative called Resilient Futures India Initiative. This is a great initiative which is partnered or created by Queen's Mary University, England, Oxford University, and along with that, so many other partners who are part of it. From India, Nirja Birla Foundation was part of it, and we started. And we have Nayan Patel, who is here right now on this platform. Lord Kamlesh was one of the very important members of that. In fact, he initiated that. And we have Professor Colin Grant. He was a part of it. And we are really looking forward to this initiative. And I invite UNICEF and NIMHANS to this initiative. Let's come together. Let's create this. As I said again and again, I keep on repeating this, and I'm not going to get tired of this point that I'm going to make, that it is the world of collaboration now. It is the era of collaboration. We have to come together. All of us have different synergies. If we come together, believe me, there's nothing which is impossible. Nothing which is impossible. We can work, and mental health is one thing which, remember, Rotary thought of it. We have something called as Rotary Action Group on Mental Health Initiative, which is doing wonderful work. But we were not that much into mental health as we were into physical health and physical well-being. But now we have realized that it's important that mental health has to be looked into. We know that we must do it, And all of us, I'm so very happy, and I really welcome this whole initiative of coming together, because that is the future.
Thank you.
That is what is going to happen. So thank you so much for inviting me. It's a pleasure being here.
Thank you, Dr. Inamdar, sir. And Dr. Inamdar himself being a doctor and a Rotarian, he can look at the issues from both sides. So what I clearly see is that from motivational point of view, we know Rotary clubs and Rotarians are high net worth individuals with the intent to serve, service above self. So I see a lot of possibilities in supporting our frontline health and care workers in coming together of Rotary with the other partners. Thank you so much, sir.
Vivek, can I request you, because Nayan Patel is there from England, so can he speak for 2 minutes, 1 minute? Is it
No, for
okay?
sure, it will be an honor.
I know it is out of protocol, but
no, not at all, not at all.
looking at collaboration.
This is an opportunity for coming together of like-minded agencies and individuals.
Absolutely.
For supporting the health and care workers. So if we can invite Rotarian Nayan Patel, sir.
Yeah, Nayan. Yeah.
Thank you, and greetings from London. I'm really honored to be present with you today. This is a great initiative, a super initiative. And I think the buzzword for me always is come together. And I think this is what we heard earlier from Professor Murthy. Coming together, collaborate, and work in partnership. That's how we are going to be able to scale up and create a bigger impact. So here in UK, I'm part of an initiative, as Dr. Bal mentioned earlier, which is called the Resilient Future India Initiative. It's a collaboration between Mary University of London and University of Oxford, where I sit on its advisory board. So really, we would welcome the opportunity to collaborate with all the stakeholders here today. And through Bal, Dr. Bal, I hope that we have an event coming up on 30th of June, actually. So through Dr. Bal, I will extend an invite to you, and we would really welcome the opportunity to have you with us. So really on that note, I'd say thank you so much. But let's work together. That's the key message I have. Thank you.
Thank you, Mr. Patel. And the COVID the pandemic has taught the world that we need whole of society, and no one is safe till everyone is safe. I think this oneness, and what we are seeing, that technology as an opportunity, one of the few opportunities that have come out of this pandemic is that technology can be leveraged to bring people together for this whole of society approach. So with that, now I would like to move to our last but not the least from our own UN family, my colleague, Dr. Atrey Ganguly. We have some interventions with the WHO team within the UN as well. And Atrey will be part of all the future NHSRC-led trainings that you see and other interventions here. So over to you, Dr. Atrey, for we want to listen from you what additionally we are doing as UN through WHO team. Atrey, are you there?
Yes. Thank you so much. Am I audible?
Yes, please.
Yes. Okay. Thank you. Thank you, Dr. Vivek, for giving me an opportunity to speak at the August gathering. I must congratulate NIMHANS, UNICEF, and Rotary to come together to create this app. Definitely, I'm looking forward to the next session to know more about the app, the Share Care app. Also, I'm quite excited to hear about the webinar series, which Dr. Anand had just announced. Definitely, we need to disseminate. A lot of things have been prepared and developed, but with the lack of dissemination, and since India is a huge country, we really need to have strategies in place how to disseminate to the last person in the community. From WHO, as you know, the definition of health by WHO, it is both physical, mental, and social well-being. So as far as health workers, mental health is concerned, we cannot compartmentalize the physical and mental health. On the physical ground, the WHO has been constantly, continuously supporting the government of India on all the pillars of COVID support, be it infection control, infection prevention and control, be it personal prevention and self-care, be it community mobilization, be it risk communication to propagate COVID advisory behaviors, and very recently the vaccine hesitancy. So these have been going on in different pillars. Also, mental health is also one of the very, very important aspect of our support, and as a part of the UN support. In fact, I would say we were the part of the task force which was created to build the psychosocial support action plan, which is at a very, very mature stage. And had it not been the COVID interruption in the last 2 months, we would have seen the light of the day. Also, suicides are of concern. So WHO has been pushing for a national suicide prevention strategy, which is like, which is a lot in line with the mental well-being of the health workers. Then apart from that, when COVID struck initially last year, there had been a plethora of publications from WHO, not only in English, but many of them were translated in many of our Indian languages as well, to reach the corners of our country. We have supported the Ministry of Health and Family Welfare, the nursing division, especially last year being the year of the midwives and nurses. So we had dedicated developing modules for them, which is for self-care, and it also has videos. So NIMHANS had played a very pivotal role in developing this, and presently we are supporting the government to take forward the cascade of trainings in this regard, especially for the nursing cadre. We always, whenever we speak of the health cadre, we usually focus on the doctors, but the nurses and the other support staff are also very much, in fact, in many occasions, much more prone to stress, and so they need some special attention. So the government of India had taken out this initiative to support the nurses. But of course, these resources are not limited to the nurses, but definitely they'll be for all health workers. In fact, all frontline workers, inclusive of the the policemen, the sanitary workers, etc., etc. WHO had also partnered with FICCI to reach out to the private hospitals, primarily on mental health promotion of the health workers, how to keep themselves fit in these turbulent times. Very recently, and a major event is going to be there tomorrow, wherein the principal scientific advisor's office has created another virtual platform called the Manas, which is the mental health normalcy and augmentation system. And WHO is going to partner for the technically to disseminate the messages to the last person in the country. With the UN agencies, of course, as Dr. Vivek had said, we are UN family. From the UN family, our own Mandarshan was an effort to UN agencies on board to reach out to mental health issues which cater to different age groups, and one of them was the COVID warriors. And we could, we had a participation from different pillars of COVID warriors, and we were able to understand what they were going through. And since it was last year, earlier in the COVID time, so it helped us to to understand and plan our next steps. Also, Dr. Vivek and other members, we had approached the NDMA very early last year to draft actionable points for the health workers, because it was observed that whatever we are doing for the patients. We are not reaching out to the workers. And as we say that first we have to strengthen ourselves, like in any emergency, we first have to put the oxygen mask on ourselves, get replenished, and then reach out to the others. And I would say that I must congratulate NIMHANS for their guidance termed as minding our minds, which is really a support to everybody in the country, and it was very well there in the the MHFW website, and which further push forward the fact that buddy system and getting together, inclusive work, etc., are really the need of the hour. So in the future, we are looking forward to working together, and I'm very happy that Dr. Vivek has really invited me for the webinar series. Thanks, Dr. For patients who are recovering from COVID, there is a concern by Government of India that there are number of mental health issues which are emerging, and we should take earnest steps to take care of them. And WHO had been asked to support the ministry on how to take forward these issues. We have been, the district mental health program under the Government of India had been reaching out to all the states to in the community to provide psychosocial support, especially to the patients who are either in home isolation or at the COVID centers, or even the migrants in the earlier part. So we had reached out to them to support them in capacity building, with an emphasis of taking care of themselves before you actually plunge into the war and be a COVID warrior yourself. So once again, thanks for this opportunity, and I'm very excited to hear about the Share Care app, which will be, I think, following after this session. Thanks.
Thank you, Atre. And what I can clearly see, and the reason for looking forward to listening from you, is that there is a lot of content already being developed in various platforms that also needs to come together. And that's one effort that Dr. Janardhan and his team is doing. So without wasting much time, I'm handing it back to Dr. Janardhan, and thanks to all the panelists for your valuable time. All of you have busy offices, and also our colleagues, Rotarians who have joined from UK and other parts, as Dr. Bal Inamdar has announced. So I'm handing it back to Dr. Janardhan, sir, and without wasting much time, we would like to listen from Sharmeen about our app, and over to you, sir, for taking it forward.
Yeah. So thank you everyone for their insightful thoughts. The message, what I'm going to take back home for everyone is, let us work together. Let us bring all our resources together so that we can deal with the problem. So working in isolation is not going to help us. So all the actors, let us come together. So it can be anyone, whoever is the participants, they all can come together. Let us come and deal with this problem, and let us learn together, and let us learn to deal with this pandemic. So this is something, the message what we am going to take back home. So now I would request Ms. Charmin to make her presentation in terms of how this manual app can be downloaded. So she's going to share the manual.
Good evening, everyone. I'm going to be briefly running you through how to download and use this app. Currently, this app is available on all Android devices. We are working on releasing this on Apple Store as well. Now, to install the ShareCare app, you first need to go to your Google Play Store, and in the search option, type in ShareCare. Once you type in ShareCare, you will find it in your list. And then you click on the install option. Once you click on the install option, the app will start downloading. Now, once the app has downloaded completely, there will be an option of uninstall and open. You need to click on the open option. And once the app opens, they will request you to enter your mobile number. So once you enter your mobile number, you will receive an OTP. And once you receive the OTP, that's the way you complete your registration process. So you enter the OTP and you click to verify this OTP. Once you have verified the OTP, there are two options. There are two requests that you need to allow. One is you need to allow the app to take pictures and record videos, and also to access photos, medias, and files on your device. So once this process is done, there are certain details which you need to enter, your personal details. These details would be your title, your first name, your last name, your gender, age, your email. They will also ask you your job type and the state and city you're living in. Once this is done, you will go to the next page where you need to enter your workplace details and your languages which you know. Now, once this is completed, there'll be a small disclaimer saying, welcome to ShareCare, which is a wellness app, and users will be using this app for their own benefit, and NIMHANS is not liable for any issues that they may face. You need to choose the agree option and then click submit. So once you have completed this process, you will be going to the next page, which will be your profile page. In your profile page, you will see all the personal details which you have already entered, like your age, gender, email, etc. And if you want to edit any of these details, on the top right of the page, you will see an edit profile option, which you can click on that and edit your details. Now, at the bottom of the page, you can see the features of the app, which is wellness, assessment, chat, FAQs, and profile. Now, I'm going to be taking you through a little bit briefly about each feature of the app. Now, the first option is the wellness page, which Dr. Janardhan has also spoken about a little bit. In this, there are videos on various topics which are available, like deep meditation techniques, yoga intervention for health workers, how to support your children and adolescents during COVID, and coping with stress, etc. And these videos are also updated regularly. Then the next option is the assessment option. In the assessment option, there are 3 scales, which is the Kessler Psychological Distress Scale, the Perceived Stress Scale, and the Insomnia Severity Index Scale. Now, you can take these assessments any number of times. And if you want to view your score again, you can click on the View History option, which will show you your score of each time you have taken the assessment. Now, once you've completed the assessment, there will be an option which shows you the interpretation of your scores. And after that, there will be some suggestions which are given by the app to you. Now, if you have a high score, the suggestion would be to go to a consultant and seek a consultation. If you have a moderate score, they will request you to go to the wellness center and check out the videos. And if you have a low score, they'll say that you're doing well and to continue to do that. Now, when you have a high score, to go to the consultant option, there's a link over there. You just click on the link. That will take you to the PDF file of all the consultants. Now, it's around 34 pages because a lot of volunteers are there. And you either need a PDF reader or a browser on your phone to open this link. And the link would open depending on the speed of your internet. So if it is a little slow, you need to wait a while, but the link will open for sure and give you the details of all the consultants. The next is a chat option. Now in the chat option, there are various topics which you can choose from. And if you have any question based on that, you can send a request for a chat, and then the admins of the app would check regarding the information which you require. And they would also get back to you and give you the required information. And this is also a 24/7 chat option. The next feature is the FAQ feature. Now in the FAQ feature, there are various topics like work and mental well-being, personal, family, stigma, support, etc. And all commonly asked questions are over here with various answers which would benefit you. So these are mainly the features of the app at the moment. We are continuously adding more features to it and upgrading it and adding more information as required. Thank you.
Thank you, Charmin, for the presentation. So now it's over to Vivek sir for his remarks.
Thank you, Charmin. And as we have heard from her, thanks to her efforts also for, bringing together the app development agency, which we were very closely working with. And
can I add something?
Is it Dr. Gautam Saha, sir, please?
Yes, yes.
Sir, please.
Can you end your presentation?
Hello.
Yes, sir. Please, you're most welcome to.
It was a really fantastic app, and I must congratulate the team NIMHANS for that. And number 2 is the take-home message is we'll work together definitely, and IPS will always be there. If NIMHANS will take the lead, bring us all together, we'll be there. Otherwise, if you tell us to be there, so I'll be there. Dr. Vivek is there. Congratulations. to all of you, Dr. Vivek especially, and Dr. Janardhan especially, for all, because you two are the key persons of this meeting. And I am also eagerly waiting to do some program and do some work for people along with all the stakeholders, those who are present together. Thank you so much. That is my take.
Thank you, sir. So as I was saying that we have heard all the stakeholders today, and this is just a beginning. And I think this came from the fact that initially when we were having discussions that there are, of course, the telehelplines of NIMHANS itself and IPS, we now heard from Dr. Saha today, they have also started. But what was more important was that why not reach out to healthcare workers and general population at the time where wellness support can help them come out of situations rather than going to a tele helpline when people are already stressed and anxious. So that was the thought behind this. And we are taking this as a beginning. And as I had said that the wellness portion, some ideas had come from various other colleagues over the last 1 year, that we curate and put some of the best motivational and other incentive-based things for healthcare workers, linking it to their memberships, and so many other ideas that can come, which make them motivated, feel encouraged, and also incentivized. When we have seen somebody mentioned about the violence also they face when somebody loses, and which has been so common during the second wave of COVID. So I'm taking this as a very great beginning of coming together of all those who wish to support our frontline warriors, the health workers. And we have heard from the MOH, the NHSRC, which is taking it to the grassroots. We have heard from a professional association of colleagues who provide mental health and psychosocial support. We have heard from our national institute, which is the Apex Institute in Mental Health. And of course, from our UN colleagues of what interventions are going that can converge for healthcare workers. And I also look up to all the Rotarians, not just in India, but across the world. And as Dr. Inamdar mentioned, with the presidential theme of serving to change lives, I think supporting the warriors first is going to be a great initiative. And with congratulations to the NIMHANS team for all that they have been doing on this topic for the last 1 year. Sometimes it takes a lot of patience. And I know, for example, just the disclaimers before somebody takes those 3 assessments or at different stages of the app was such a big technical issue I learned from NIMHANS. And I'm taking this as a good beginning, thanking everyone for their participation, including our director, Dr. Murthy ma'am, who's not here now, Luigi, the Chief of Health at UNICEF, and all those colleagues who are still present with us. So with this, I would hand it back to Dr. Janardhan for closing. But I must mention that taking cue from IPS, that they will have helplines from all various languages. If agencies like Rotary and others can also help NIMHANS in translating this app into different languages so that it reaches more people on the front lines, just a simple action, which can be done with not much resources. And I think I see the thumbs up from Dr. Bal Inamdar, sir, which is very encouraging. So with that encouraging note, I hand it back to Dr. Professor Janardhan, sir, please.
Yeah. Again, I would like to thank you all, but I also look forward in terms of if you can, all the participants, if they can share some of the motivational videos or some videos, if they found it something useful, they can send it back to us, and then we would screen it, and if possible, we can put it as part of wellness.
Yes, sir, can I request
a lot of
something?
Initiatives carried out in the country by various stakeholders. Let us try to capture those resources and try to put it as part of the app. Vivek sir, you wanted to say something before I thank?
So that's a great idea. If Charmaine can put her phone number, WhatsApp number in the chat, please, for people to please share content. And we will also have prizes. We are thinking soon of the best content contribution. And for that also, I look up to Dr. Bal Inamdar, sir, which we can have one-to-one talk. Back to you, sir.
I think this has created a platform of bringing in various stakeholders, and a lot of commitments been coming out from the people. So we are going to take it up and in a big way. And if it can be translated into the local languages, that will be something great. Let us look in terms of how to take this further, and let us bring all the actors together and act on it. So as part of this last part of the webinar, I would like to propose vote of thanks. First of all, I would like to propose vote of thanks to our beloved director, Dr. Pratima Murthy, who just assumed the responsibility and was able to keep up her commitment, what she had agreed upon just few days ago. So I would like to thank her for her commitment and for her motivational talk, which would help us in terms of taking this further. And I also would like to thank Professor Shankar Narayan Rao, who is our registrar from the institute, who has been instrumental in terms of providing administrative support to all of us. And I also would like to thank all the HODs from the Department of Psychiatric Social Work, especially Dr. Dhanashekhar Pandian, who has been behind all these initiatives, and he encourages us to carry out activities and to partner with various organizations and take up activities not only within the hospital but also outside the hospital. I would also like to thank my colleagues from the department who has been instrumental in terms of providing support for me to carry out these activities. And other HODs like Department of Clinical Psychology and then Department of Psychiatry and Department of Child Autism Psychiatry. All these members have supported me to carry out these activities. And also I can see the presence of many of my teachers who have been there, and they have been constantly supporting me, encouraging me and blessing me in terms of taking out these activities. And I would like to thank all the panelists, Dr. Gautam Saha, President of Indian Psychiatric Association, Dr. Bal Inamdar and Dr. Patel from Rotarians, Dr. Atria Ganguly, and then Dr. Arati Jagannathan, and then Dr. Vivek Virendra Singh, who moderated this panel discussion. And all my app development team deserves appreciation because they have put a lot of effort in terms of developing this app. And also I'd like to thank UNICEF team, Mr. Luji, and then Dr. Vivek Virendra Singh, Ms. Priyanka, and many other people whose name I have not taken have been playing an important role. And last, I want to thank Anant Kumar, Dr. Anant from NHSRC. We are going to work together and let us bring all the resources together and then deal with the problem. So with this, again, I would like to thank all the participants who have been patient enough since last 2 hours. They have been listening to us and given their appreciation to the work what we have done. And let us work together. And I look forward for more comments and suggestions so that we can improvise this app and make this app reachable to the entire country. Each corner of this country need to be reached. This is something I am expecting. Thank you all.
Thank you. Thank you very much.
Thank you.